pula ini? Takkan dia keluar pula? Bos. Habis poster yang saya hantar sebelum ni takkan bos tak boleh nak pakai balik? Ya bos, ya. Nanti saya buat balik semula lah. Ha? Ya bos. Ya, saya janji. Selewat-lewatnya dalam minggu depan saya siapkan. Boleh bos? Ya bos, ya. Boleh. Minggu ni saya cuba bos. Minggu ni saya cuba saya siapkan. Ha? Assalamualaikum, Mak. Ya, kenapa? Tak ada apalah. Tadi Man baru habis cakap dengan bos Man. Okey, Mak. Man okey. Tak ada apa, Mak tak payah risau. Okey, Mak. Ya. Waalaikumsalam.
Aiman is a graphic designer who lives alone. Ever since the first RMCO, he's been working from home. However, he's getting nervous, as his company, an event management company, is struggling during the pandemic. Stay with us to find out how the COVID-19 pandemic is affecting employees' mental health. I'm Charles Roberts, and this is Mind Matters. The COVID-19 pandemic means that many of us are staying at home and doing less in terms of social interaction and exercise. This can have negative effects on your physical and mental health. Employment uncertainties and the economic outlooks affected by the situation makes it even worse. As countries introduce measures to restrict movement as part of efforts to reduce the number of people infected with the COVID-19, more and more of us are making huge changes to our daily routines. The new realities of working from home, temporary unemployment, lack of physical contact with other family members, friends and colleagues take time to get used to. Adapting to lifestyle changes such as these and managing the fear of contracting the virus and worry about the people close to us who are particularly vulnerable are challenging for all of us. They can be particularly difficult for people with mental health condition.
If you look at mental health and you compare that to physical health, Physical health is a result of most likely mental issues. And during the pandemic, obviously we're talking about a lot of stressors, lots and lots of stressors that impacts us. And unfortunately, the things that we normally do to release stressors, we can't do. We cannot go out and exercise. We cannot go out and socialize with people. When the psychological aspect of it impacts us, and we are unable to cope with the current situation, so it's going to have a negative effect on the long run. If we look at Aiman's case, it's a typical case that most of us are going through during COVID-19. Working at work is less stressful than working at home because we lack the support. And we lack the support of our colleagues, we lack the support of interaction, and so on and so forth. And to be honest with you, at home, there's actually no stoppage, so to speak. When you are at work, you have a meeting, you go from one place to the other, there is a break there. But at home, it's continuously one after the other. You cannot take a break, and you don't have the support of your colleagues, and it's tough. It's tougher working at home than working at work.
Sedentary behavior and low levels of physical activity can have negative effects on the health, well-being, and quality of life of individuals. Self-quarantine can also cause additional stress and challenge the mental health of citizens. I'm Charles Roberts, and this is Mind Matters.
Membincangkan topik berkaitan kesihatan mental, Obsessive Compulsive Disorder (OCD) bersama pakar psikiatri yang berpengalaman. Mind Matters setiap Sabtu 8 pagi.
Working at work is less stressful than working at home.
Kids with ADD and ADHD on the average may have a slightly higher IQ.
Semestinya hanya di saluran Okey.
Bagi meningkatkan kejayaan Bumiputra, dasar pelaksanaan kota pemilikan kediaman Bumiputra akan diperkukuh melalui kerjasama yang lebih erat antara kerajaan persekutuan, kerajaan negeri dan pihak berkuasa tempatan. Selain daripada itu, bantuan keuangan, bimbingan dan pementoran oleh institusi keuangan akan diperluaskan bagi menyokong usahawan Bumiputra.
Many people have lost their jobs while working reduced hours. Due to the enormity of the pandemic and the global shutdown, the sense of normality has been turned upside down. The uncertainty over what even the near future holds will make sustained attention a challenge.
Halo Ceng, apa cerita? Asal bos nak jumpa kau. Betul ke Ceng? Benda-benda macam ni kau jangan buat main-main. Azmi yang sekali. Ni tak adil Ceng. Mana boleh senang-senang syarikat nak berhentikan kau orang macam tu? Yelah, aku tahu sekarang ni syarikat projek dah tak banyak, dah tak ada dah pun. Tapi aduh, sayang, aku minta maaf lah sayang, aku tak tahu nak cakap apa sekarang ni. Takkan korang berdua je yang dapat surat berhenti tu? Tak maaf, Ceng. Tak boleh nak cakap apa. Aku harap lepas ni kau dapatlah kerja cepat-cepat. Azmi sekali. Tak apa, Ceng. Nanti apa-apa, kau telefon aku,
Coming back to Aiman, the current situation in his company does not help. 2 of Aiman's team members have already been laid off. Aiman is anxious. He is going to lose his job.
Unfortunately, in our country right now, layoffs is part and parcel of our unfortunate culture right now. And the fear that he himself will lose his job is very evident. And I would say realistic, because that does happen. How is he going to raise himself? How is he going to feed himself? Aiman is a single individual, so it's not too bad. But in many other families, you have to think about trying to support your family, your parents, and so on and so forth. And the other anxiety with Aiman is that he has a relationship with his girlfriend, and it's challenging because you're not able to meet, you're not able to, have a proper relationship. So I think those are some of the things that he can be concerned about.
How you respond to stress during the COVID-19 pandemic can depend on your background, your social support from family or friends, your financial situation, your health and emotional background, the community you live in, and many other factors.
Some of the signs, of course, is a person will feel very demotivated, demoralized, because they don't know what the future is going to be, what's going to impact them, and so on and so forth. And when they look around them, they look at the impact of COVID-19 on their peers, your friends, and all that sort of stuff, there's a huge concern about them. And of course, part of the signs also could be being suicidal, having no hope, thinking that they fall into a huge rut and they cannot come out. They've lost hope, so to speak. So we talk about signs of COVID-19 illness, sleeping disorder, eating habits have changed, energy level is low, they isolate themselves. These are some of the signs. We talk about someone who is impacted by COVID-19. And one of the things that sometimes what happens is that the individuals are so embarrassed that they withdraw from society, withdraw from family, don't want to ask for help and support, thinking that they will look weak and so on and so forth.
Though Aiman is worried, he finds that he's waking up later and later each day. Instead, he stares at the computer screen and plays game on his mobile phone.
So there are a lot of concerning trends as indicated. The rate of suicide has gone up tremendously. The rate of marital discord, divorces, has gone up. Violence at home has gone up tremendously. Demotivated, people are demotivated, they see no hope, this turning over. The rate of hospitalization also has gone up. So COVID, physically, yes, we see it, but we don't realize the impact emotionally and how it impacts individuals, how it impacts families, how it impacts children. So it is very, very concerning.
In June, Aiman is laid off. Aiman does not want to tell anyone about his situation, especially his parents, because he doesn't want to be a burden. He worries because he has car payments to make. Aiman wonders if his parents will be better off without him. Adaptability is a requirement because change is constant and inevitable. The hardest changes to understand are the ones that are unexpected and out of our control, such as the global pandemic or a recession. It can be hard to come to terms with, but the experience of it can be made better or worse, depending on one's reaction and attitude. The thought scares him. He reaches out for online therapy. The therapist diagnosed Aiman with depression and anxiety.
Exercise, to be honest with you, is one of the things that is going to assist us in reducing our stressors. That's definitely something. And of course, we have to be creative. We have to be agile in regard to how we conduct, what kind of exercises do we do within our four walls, so to speak, you know, and try to have activities that we can do with our families, you know. So that's important to do. Keep a routine. Now you have to keep a routine. Your sleeping habits, you have to keep a proper sleeping habits, eating habits and all that sort of stuff. You have to do that. Communicate, yeah, as much as you can with family members and so on. Yeah, social media is there. Yeah, try to communicate as much as you can with the people around you. Provide support groups within the family as well. You know, we have WhatsApp groups, am I right? So WhatsApp group can be very, very supportive to each other and so on and so forth. Besides the family members, there are a lot of support groups. We can reach out to them, okay? And also one strategy or technique, we can reframe things, reframe how we look at things. Unfortunately, the current situation, the way we look at it in black and white, it's stressful. But reframe it, try to be optimistic. It's not going to be there all the time. It's going to end sometime. So we have to reframe it. We have to be a little bit more optimistic. Use the family, reach out to the family, reach out to the support group. Do whatever creative exercise that you could do. Yeah, and try to be as agile as possible. And last but not least, I know it's easier said than done, try to be optimistic about the future. It's not going to last that long.
Okey, Aiman, sekarang daripada apa yang Aiman ceritakan pada Kak Nora tadi, ya, sekarang apa yang Aiman punya perancangan selepas ni?
Sekarang ni Aiman dah pun senaraikan hutang-hutang yang Aiman ada. Kemudian nak tak nak, sekarang ni Aiman kena juga kira balik, cek balik berapa simpanan yang Aiman ada dalam bank. Kemudian lepas tu barulah Aiman pergi jumpa pihak bank. Yalah, minta pendapat, mana tahu ada kelonggaran untuk selesaikan masalah Aiman.
Okey, sounds like a good plan. Kalau rasa itu adalah perancangan yang bagus sekali. Itu langkah pertama yang Aiman perlu buat, ya. Okey, apa lagi yang Aiman rasa Aiman perlu buat lepas?
Sekarang ni Aiman rasa Aiman nak kena lupakan benda yang lepas. Nak tak nak, Aiman kena buat balik resume macam dulu-dulu minta kerja. So Aiman kena cari balik kerja lain lah kat luar.
Okay, sounds like you're gonna get busy.
Well, several things. One of the things that I can say is that, you know, remove yourself from chat groups, WhatsApp groups that are negative. Remove yourself from that. It's not worth it. You know, that's one of the things that you could do. Obviously, we talk about if you have done everything you could, obviously you go for professional help. Yeah, get professional help. Try to focus on the positives instead of the negatives. Reframe the situation. Yeah, reframe it. It's not always all bad. Stay informed. Yeah, with the right sources.
Cognitive behavior therapy teaches how to replace anxious thoughts and behaviors with more helpful ways of coping, and it can be offered via telephone.
Therapy will help you understand what are the problems, what are the issues, how do we address the problems and issues. Each individual is different in regard their ability to handle stressors or to handle the issues. So some person need a little bit more help, some people a little bit less help, and also the coping mechanism is different for each individuals. So therapy is important, definitely is important, and it gives you some answers to the things that you're always wondering what's happening, what's going on, why am I feeling this, that, and all that sort of stuff and so on. And also you must understand, therapy allows you to deep dive a little bit into your thoughts. As a therapist, we don't tell you what's happening, what's going on. We enlighten you, so to speak, give you opportunities for you to look at from different perspectives and help yourself, so to speak. Each and every one of us probably would benefit by different types of therapies. One of the things that we can share with Aiman is that it's not hopeless, totally hopeless, because to be very honest with you, the government, I think, has provided a lot of penjana type programs, a lot of assistance type programs. There is a lot of assistance out there financially as well. So, you know, we need to lead him towards those assistance for him to have hope. He has to apply for it. We can apply for him, but we need to let him know that there is hope, there's possibilities and all that sort of stuff. And of course, to let him believe that it's not going to be forever. There is going to be a time when we will resolve all our situations and so on. A lot of people is in 9-month situation, a lot. So we have to give them a lot of hope, regardless of what type of therapy that we're talking about, you know, whether group therapy, individual therapy, and so on and so forth. But, you know, just to give him hope and to encourage him to do whatever needs to be done with the resources that are available.
Physical activity and relaxation techniques can be valuable tools to help you remain calm and continue to protect your health during this time. WHO recommends 150 minutes of moderate intensity or 75 minutes of vigorous intensity physical activity per week, or a combination of both. Our anxiety is helping us cope, bond together from a physical distance, and slow the spread of virus. So our anxiety, while it makes us uncomfortable, may also be a good thing right now, especially if we manage it well. It may be helpful for you to make a list of things that you can and cannot control right now. In this guide, we suggest radical acceptance of the situations that we cannot control and focus on what we can do. Thank you for joining us. We hope to see you again. I'm Charles Roberts. Stay safe.